Kevin and it's Marina from RPH Ally. We're so excited to have you guys today. Interesting topic that Marina actually wrote a blog article about just recently that populated on RPH Ally and across everything that Marina is doing inside of the holistic pharmacist. And it is about the role of herbalism for potential healthcare cost savings, a global comparison analysis. Sounds very official, Marina, but we'll be really excited to be able to tell you how to save your patients a little bit of money and look at some alternatives to modern allopathic practices. Talk to you guys in just a second here after we hit this reel. Hey, Marina, good to see your face for sure. How has your week been so far?
Hey, it's been busy. Summer is flying by. I can't believe it's like halfway done already.
Oh my goodness, don't tell me that. Yeah, it's so true. I guess it is into July. We have lots of exciting things kind of coming up, but with stuff coming up, Marina, I know that you have an educational webinar that is coming up, correct?
Yes. So tonight, actually, I have a pilot event where applying for the ADA, the American Dental Association, continuing education accreditation. And so I was invited to do this pilot presentation to dentists, but also open to other healthcare professionals, including pharmacists. So if you want to join us tonight, the only caveat is you don't get continuing education credit tonight, but it's free. So you can come and learn about herbal implementation in healthcare.
How sweet. That's fantastic. And it's herbal implementation in healthcare with a slight focus toward dentists.
It's mostly just an intro topic of safety, effectiveness, legal status. So anything that any professional must know.
Oh, got it. I thought you were going to go like microbiomes and dental caries and all the details there.
Maybe for a paid CE, yes. I will do that.
Fair, very fair. But our topic today, Marina, really looking at like the costs of one versus the other. It's so interesting because you and I have mentioned like the fact that you could literally walk out into a field and be able to find things that would be able to assist you with kind of your palliative needs necessarily. But here today, we're really talking about modern medicine in general and kind of the scope of all these different disease states, how allopathic is approaching it, how natural kind of approaches are coming at it. Give us some more details on your article you put together and how we should think about this.
Yeah, absolutely. So I sort of, let me see, I put a link in the comment, and anybody who has Google or any search engine, you can start to compare health costs from country to country and then really dig into what makes up for this difference. And some of these differences are, enormous. So it's not just, the GDP of a given country that's accounting for the difference in dollars. It's really how is healthcare administered and implemented and what goes into those calculations. And then when we dig into chronic disease care specifically, we see that America is spending so much money and resources caring for chronic diseases, which comes at a cost, which is why we put this punny title up, is that yeah, you can buy really great healthcare here in the US. We're renowned for the best doctors and surgeons and acute care. I'm not debating that. That's amazing that people have this type of access here. And again, people from all over the world seek the knowledge and guidance of our top experts. Amazing. However, with the chronic disease piece of it, we're continually pouring dollars and dollars and dollars into pharmaceuticals and other ways that we mostly treat these is pharmaceuticals and some surgeries down the line too. And we're missing big pieces that should be standard of care, in my opinion, from the public health and preventative perspective, which could really account for some of the price differences in other countries.
That's fantastic. One note on that, I'm glad you brought it up, is I was just reading a study showing that around 50% of all the new approved drugs, Marina, don't actually show clinical efficacy beyond what's already available. So we're adding on more expensive drugs inside of the United States that don't actually show additional benefit around what's kind of going on and what's already available in our kind of our current circumstances. And I love that you highlight something that I have never thought of, to be perfectly honest. When you looked at that World Bank data, and I'm thinking, this is the cost in one nation versus another, really in my mind, it was, this is just the cost of care. We've inflated it significantly and didn't think about what's the culture behind care. What are the other alternatives to utilizing the care system? So I think those are fantastic to dive into. And is there something that you kind of looked at that shows these nations utilize these other modalities of care?
Well, I just dropped a link into my blog, the one that you mentioned that I wrote recently, and I tried to pull up the most current data whenever possible. So, data from like 2018 to current is really showing us that, for example, comparing us to a lot of the Asian countries, including China, which does implement a lot of natural and even has acupuncture and traditional Chinese medicine side by side to the allopathic systems, even in hospitals and acute care settings.
Yeah.
That could account for it. I mean, it's hard to say exactly which factors, as well as diet. Diet is a huge one. Pollution, environmental toxicity is a huge one. So, there's a lot of confounding variables, but the more that I study what contributes to health and what contributes to disease, the more I understand that you can have the best doctors, you can have the best tests, you can have the best invasive procedures. And again, it's awesome at saving lives. I love it. I'm so glad we have access. I am an example of somebody who benefited from acute care quite recently in the hospital setting. So I love that we have this progress. And on a day-to-day basis for not acute situations, for self-care and just making sure we're taking care of ourselves, it's becoming increasingly difficult to have that individual approach, again, even with the resources and the best doctors, because we're not addressing the health of the whole planet. We're not addressing how we are doing agriculture, how we are doing and dealing with industrial waste and plastic and all of this stuff. And that's why every single generation we're getting sicker and sicker. We don't have enough nutrients in our soils and in our foods. So now we have to go to the nutraceuticals. And now we're depleting those too. And there's lots of stuff going on in the plant and nutraceutical industry too. And then we're going to drugs, and then that's adding more pharmaceutical waste everywhere. Not to mention, what you said about the research and the cost of that. So we're not really solving the issues. We're sometimes just adding to the chronic and the allostatic burden of each body, because we're not designed to deal with this much pollutions and toxicity. So our body's having to work double time.
Well, I mean, you're right. You're not putting in what you need, and you're taking out, or you're adding on additional burden to be able to extract what we're already having, to take care of us. And I think that's an interesting thing about just the cost of modern medicine is, in that pun sense, that is one of the costs. Like, one of the costs is the cost of modern medicine, as we have turned something into a very profit driven element. Like, we're trying to make sure that we can make money off of the things that we are creating to keep people healthy or to make them healthier. And so I do think it's a really interesting cultural component. The other day, Marina, we were talking about, should medicine be free? Like, should we make a free healthcare system? And I think it's a loaded question. We won't jump into that one at all. But I think the one thing that we can touch on is this piece. If it is free, we do have several free examples throughout multiple nations, including the US. Me being Native American, I did not have to pay for anything inside of IHS. But that didn't mean that the healthcare was fantastic every day and that I was seeing better gains in that population overall. And so I feel like there's an interesting cultural component that's related to modern medicine in the way that we think about healing, in the way that we think about, utilizing our resources, that says, I'm going to continue going down the path that I'm going down and be able to give myself the most satisfaction, endorphins, et cetera, in life, and not put the effort into my health, because I'll be able to flip that switch over at the doctor's office and they'll make me healthy automatically. And you and I both know that's not true. And we can show billions of dollars of waste and evidence that the United States is doing very poorly with that mindset.
Yeah, I absolutely agree. And I even have met people like that in my life, when they're like, you know what, I can abuse my body, so to speak, when I'm young, because I'll deal with it. And then, I'll deal with whatever consequences later, because there is modern science. And I think beyond the scientific pursuit of discovering how things work, which again, I'm a huge fan of as a scientist, more importantly, it's to address why are these things here? Why are we here? Why do we need our health? why should we care about our health? Why should we care about the planet's health? And asking the why questions, like what's the why behind the how? Why should we care about the how? you know, so we need to put that first and foremost, and we need to start putting people over profits, because we can't continue down this path of destroying and destruction, without repercussions, because we're living proof that our children are sick, people can't get pregnant, people, kids are all on the autism spectrum or whatever kind of spectrum.
Yep.
I mean, it's really, really difficult to see that, and that we can help individuals perhaps, but we really need to address why is this happening globally?
Yes. Yeah, I think there's an interesting difference between keeping folks healthy and getting people back to healthy. And I think that mentality shift is something that I would love to see, within our lifetimes, or hopefully for our children, Marina, that we're having more individuals recognize that necessity. And I think there's the real split. Like I don't think either Marina and I are ever saying you need to shift over to herbalism and non-allopathic medicine entirely, and that is the only space. It's not the case at all. Like there is a good blend and a good mixture of the two that can really allow for a cost burden to be decreased by taking advantage of things that are less costly, and a mindset of health that allows for a decreased burden on that chronic disease state manifestation towards more expensive procedures, more expensive treatments, and everything that goes along with it. Because one thing to explore, I think that's really like topical right now, Marina, is everything in the biosimilar space is it's so hot. Like,
yeah,
wild. Like the amount of money that's going into it is incredible. The amount of money extracted from it, the political environment looking at biosimilars, especially when we're looking at anything in the inflammatory pathway, right?
Mm-hmm.
And there's some really interesting evidence of diet playing a pretty major role in these inflammatory factors that are happening. And sometimes, wild as it may seem, folks would rather go toward, I want this infusion, then I want to make these changes and modifications in my lifestyle and diet. And I think that is maybe a microcosm of the entire situation, but a very, very costly one. Any other thoughts there, Marina, on that one piece of the cost of modern medicine?
Yeah, so much. I mean, specialty pharmacy and all the biologics. And like you mentioned earlier, like all the Me Too drugs that, you just work around, you tweak the molecules, you brand it, you spend billions of dollars marketing. And, I just always thought it was wasteful, because you don't have to start reinventing the wheel. Like, how did we get here, right? And why are we still here? So looking back to our ancestors, we could see what were these major differences, like how come they were able to survive without modern medicine, and lead us here to this point, and what are the evolutionary benefits that are generationally passed down to us, and why now are we having such trouble managing our health that historically was never the case. And it all comes down to lifestyle and environment. Diet plays a role in that. But it's really just how we live our life and what's around us, how we see the society function around us, what is considered normal, the fact that there's stress, and then how we deal with that stress, and including physical stress, like with the environment and the toxicity and the pollution and chemical sensitivities, multiple chemical sensitivities. So these chemicals can be life-saving. The surgeries can be life-saving. Again, I appreciate that. But we're seeing people return to the hospital, to the emergency room over and over and over again for exacerbations of a chronic condition, which should be treated at the root level. And that starts globally, really starts thinking about, like, how do we deal with this as a country? How do we deal with it as a earth, like all the countries, United Nations perhaps. But we need to set some industry standards and goals, including per capita cost of healthcare, and how we start to approach public health and prevention and treatment.
Yeah, that's very interesting, because I think the per capita piece was one element that I was skimming through with your article that you wrote. According to the Commonwealth Fund of 2023 and 2021, the U.S. spent a little over $11,072 per capita on healthcare, the highest among countries analyzed in their study. And this expenditure was significantly higher than countries such as South Korea, which spent somewhere around $2,690 per capita. And we're talking about more than a 4-time increase per capita for us to be able to take care of some individuals. And I'm wondering, in that, Marina, when we're talking about goals like setting individual thresholds, did you come across anything that showed you that some of these countries that were lower per capita, what their usage was of Ayurveda or any other medicine modalities?
So I didn't go as deep. I do want to continue to further and get more granular with this information and try to figure out what are these contributing factors. My assumption could be that it's herbalism and self-care, but maybe there's some other things I haven't considered. But I just put also in the chat, there's also a difference between how much one can spend on herbal medicine versus pharmaceutical medicine. And that's just astounding, too, per capita. So something between from $30 for herbals going to $1,200 for pharmaceuticals. And when we think about herbs in their crude form, which again is herbalism is all about, could be just available abundantly, what we think of as weeds growing outside that could just be free. And the only downside of using them is if they've been sprayed with pesticides or chemicals that people just, spray all over the place. So we really need to start thinking about what are these repercussions of having these pesticides and fungicides and all of the antimicrobial, and agricultural standard practices that are making the difference. And people could even say like, okay, Europe has more stringent guidelines. And when I'm in Europe, I can eat gluten, where here I have to adhere to gluten-free. Like, why is that the difference? So we really have to dig down to these practices and find out that it's much more than just fast food versus, slow food, though that is also a cost, slowing down and actually eating and tasting your food just alone, even if you were to eat fast food, would make a difference. So that, that's been studied. But we need to look at it all at this point, and we need to start implementing it all preventatively.
I love it. And I think the story that I think of is, I remember learning about baby carrots. Marina, do you buy baby carrots for the family?
I do not.
So baby carrots are a great example. I don't know if anybody buys baby carrots for their kids. So super tasty. They're really small, look like miniature little carrots. Well, all they are is just
kids.
Yeah, you give them to kids, a little bit of ranch dip, and you're set. But with baby carrots, like growing your own carrots in high quality soil will produce more nutrients per individual carrot. The baby carrot is just a processed large carrot tumbled down into a small little bite-sized snack. And so, not to say
bleached.
And sometimes bleached. Exactly. So there's a number of factors that take something from its raw form, which getting it to the form, because you could literally pull something out of your garden, wash it, cut it into bite-sized pieces, and now you've got something with a much higher density level of nutrients and something that is much cheaper for your family. I think that is something that is a pretty good evidence component of what we talked about this whole day. Modern medicine, when we find the baby carrots of modern medicine, that's when we should look toward other modalities. What do you think of that, Maria?
I love it. Yes. And even the act, I'll just say one more thing, the act of doing that and, cooking with love and with intention for your family is something we've got away from as well in society. And even if you don't eat fast food, you may go out to eat all the time in restaurants. And the fact is, you don't know if somebody's preparing your food with what ingredients, what oils, what inflammatory components, how they're doing it, what temperature, like all the practical factors, and also the intentional and putting in that care and love into it is missing too.
Amen. No, I can't agree with you more. The only thing Marina had left for you is we've got a really exciting event happening in, 5 days. We've got 5 days now for you guys to go and grab your tickets for the first ever RPH Ally Summer Soiree. Marina is one of the incredible speakers there. And we've got, I think, 20 plus other speakers that are specialists in their area throughout the nation and talking about what pharmacy is looking like today and the future of pharmacy with their given purview. So I can't be more excited about it. It's going to be so much fun. Thanks everybody for buying your tickets and coming. We hope everybody else that's listening will grab a ticket and go. We'll plug that into the show notes for you guys to look. Any other parting words, I guess, Marina, on the soiree?
Yes, Kevin did such an amazing job. He has so much fun things embedded into the experience. We want to make it as hands-on and live and fun as possible. So it's not just going to be, lecturing to you. It's really going to be interactive and fun. So I really hope that you come and experience it for yourself.
Awesome. Love it. And we do have CE available there too. So that'll be super fun. We can plug those in. We can have fun and learn and get all our credentialing stuff done at the same time. But thank you guys so much for tuning into the episode. If you have any questions, please let us know. Talk to you soon.